Welcome to the demonstration video on the TB module of the Integrated Health Tool for Planning and Costing, referred to from now on as IHT. You can access the TB module of the IHT at tb.integratedhealthtool.org. This video provides an overview of how to start and configure a new projection file. In order to start a new file, you hit the button to create a new file and then specify the file name, the years to analyze, the country for which it should pull in default data, and whether to include an impact model. In this example, I am naming my file Demo1, selecting Burkina Faso for the years 2023 to 2028, and including the statistical impact model. Once I have made my selections, I complete the file creation with the Create button. The first step of work with the IHT is to configure your file to fit the country context. This includes customizing the intervention list to fit with your plan. As seen in this menu, you can expand the TB health area to show the list of intervention groups and then use the arrows to expand the list and show the full list of interventions within each group. Larger monitors will show the intervention list to the right of the intervention groups, while smaller monitors or laptop screens will show the intervention list below the intervention groups, and you'll need to scroll down to see them. The interventions are organized into a cascade of care that includes patient-initiated case finding, provider-initiated screening and diagnosis, drug resistance detection, treatment, monitoring, and other associated interventions like non-medical support and adverse event treatment. You can uncheck the boxes for any subgroup or intervention which is not relevant for your setting. For example, if there is no mining industry in your country, you can uncheck the tick box for miners, and that intervention will not show up in subsequent editors. You can also add custom interventions here. For example, if you want to cost a plan that includes leprosy treatment, you can add that intervention here. You can also rename existing interventions using the pencil icon. For example, if non-medical support in your country is primarily for nutrition, you can rename it to be nutritional support for greater clarity. None of these changes are irreversible. You can continue to add, edit, rename, reactivate elements as your plan progresses. The next configuration option is for delivery channels, or the levels of care at which services can be delivered. By default, the TB module of IHT refers to 6 levels of care: community, outreach, pre-hospital emergency, general outpatient, first referral, second referral, and above. Delivery channels can be customized by renaming using the pencil icon. For this example, I'm going to rename general outpatient to be clinic. They can also be left out of subsequent sections by unchecking the selection box. The rationale for this section is to set up a structure that will allow the delivery of each intervention across the array of delivery channels. For each service or intervention listed in intervention groups and interventions, you will be distributing across these levels of care through percentages of care at each delivery channel. You can then generate results like numbers of services or costs of care by the delivery channels. As you'll see in subsequent demonstration videos, intervention inputs can vary by delivery channel in order to reflect varying delivery costs or access to drugs, diagnostics, or different health services by delivery channel. If users wish to include private, penitentiary, or other delivery channels in the costs reflected, they should add them as an additional delivery channel using the Add Custom Delivery Channel button. We move next to facility and staff types. Default facility types are drawn from the WHO Universal Health Coverage Compendium. For the TB module of IHT, they are solely used to identify the different types of service delivery points, which may need to be equipped with equipment to deliver the care under consideration. You can change the names of the facilities, add additional, or uncheck those which are not relevant for your plan. One thing to keep in mind is that we have to teach the tool how to treat new facility types. So once you add a new type, you will map it back to standardized categories that identify whether it is a service delivery or support facility, identify what the closest type of default facility is, which is used to generate default equipment lists, and assign it to a delivery channel so that if you generate costs by delivery channel, they are captured appropriately. In this example, I am adding a national reference laboratory and unchecking pre-hospital emergency so it doesn't show up later. Staff types follows a similar process as facility types. There is a default list of staff types which are drawn from ILO's International Standard Classification of Occupations staff types. You can uncheck or deselect those which aren't relevant, rename them to more closely align with country providers, and add new if needed. Staff types are primarily used to identify the cadres which provide services. As such, if you delete staff types which are used in intervention inputs, you'll need to repopulate them. So we encourage users not to delete staff types on the first pass, but come back and do that later after you've reviewed intervention inputs, if needed. In this example, I'm adding TB counsellors and mapping them as community health workers. One other option is that if you want new staff types to show up on the list in intervention inputs, you can select that option instead of mapping to an existing default staff type. Configuration includes a section where users configure and populate a database of inputs for program support activities and their associated prices. As you can see on the screen, there is a default list of inputs. Users should review and enter prices as well as notes about the assumptions and source. For example, I'm entering $30 a day for training per diem, and I'm putting the source as the MOH circular. Once you have reviewed the list and started to populate the program costing section, you may find that there are inputs that are missing that you need. You can add them here and include the prices. For example, I'm now adding a poster with an assumed price of $3. You can also add additional input categories if needed. It is important to note the unit of measure for each input. This will have an impact in how you include it in activities. For example, a monthly salary would be reflected differently than an annual salary, so it is important to include a unit of measure to ensure proper use of the unit prices. The currency and inflation section is used to identify the exchange rate which is used to transfer cost entries between US dollars and local currency, and to select which currency you want to enter data in. You can switch back and forth if you want, for example, entering drug prices in US dollars and training costs in local currency. Just make sure you are clear on which selection has been made at any given time. You can also enter an inflation rate for both currencies. This is applied to results as part of the final calculation process, so you should not incorporate inflation into your unit prices, but rather, if you want to include inflation in results, use that option when configuring results, which we will show in a subsequent video. Note that the cost databases are stored in dollars. This means that if you are entering data in local currency and then change the exchange rate, you will see changes in your entries. For this reason, exchange rate is something to finalize early in the process. Batch entry allows you to complete most of the same tasks as I showed in earlier configuration sections, but to do more entries at once, or to pull information from other IHT modules. The Configure Existing Elements section allows you to map items which have already been added to your file on one editor instead of individually, and to pull in interventions from other IHT areas. For example, if the plan that you are looking at applies to lung health more broadly, you may wish to incorporate asthma or COPD interventions, which you can find here. One caveat is that you would need to enter information about the target population, as non-communicable diseases are not modeled as part of the TB population estimates. If you go to the Add New Element section, you will find a series of editors where you can copy and paste from Word, Excel, or Notepad, and then map the entries in bulk. As the instructions on the screen note, you must use keyboard shortcuts like Ctrl-V to paste in order to comply with browser security requirements. In this example, I am copying a series of facility types from Excel into the editor. You can also type entries in. In either case, you would then follow a similar process of mapping or teaching the software how to incorporate the new items you have added. For example, if I added a new facility called a zonal hospital in the previous step, I need to map it to the most similar default facility in order to pick up things like default equipment lists. This covers the main configuration steps. Thank you for watching, and please reach out through the Contact Us button at the bottom right of the screen if you have any questions.